Hello and welcome to Medical Dialogues, your daily dose of health and medical news. I'm Mr. Zaman and here's what I bring to you all from the world of medicine. Yoga, when complemented with regular exercise, improves cardiovascular health and well-being. A 3-month pilot study of patients with hypertension demonstrates that adding yoga to a regular exercise training regimen supports cardiovascular health and well-being and is more effective than stretching exercises. The incorporation of yoga reduced systolic blood pressure and resting heart rate and improved 10-year cardiovascular risk. For the study, investigators recruited 60 individuals with previously diagnosed high blood pressure and metabolic syndrome for an exercise training program. Over the 3-month intervention regimen, participants were divided into 2 groups which performed 15 minutes of either structured yoga or stretching in addition to 30 minutes of aerobic exercise training 5 times weekly. Arsenic-contaminated water and antibiotic resistance in children linked, according to a study. In rural Bangladesh, areas with high levels of arsenic contamination in drinking water compared to areas with less contamination have a higher prevalence of antibiotic-resistant Escherichia coli or E. coli in both water and child stool samples, according to a new study published in PLOS Pathogens. While the major drivers of antibiotic resistance are the overuse and misuse of antibiotics, natural elements such as heavy metals can also promote antibiotic resistance. Alternative medicines for heart failure may have some benefits or even potential risks. There are some benefits and potentially serious risks when people with heart failure use complementary and alternative medicines or CAM to manage symptoms. This is the recent scientific statement of the American Heart Association published in the journal Circulation. They recommend involving the healthcare team for safety. The statement defines complementary and alternative medicine therapy as medical practices, supplements and approaches that do not conform to the standards of conventional evidence-based practice guidelines. Complementary and alternative products are available without prescriptions or medical guidance at pharmacies, health food stores and online retailers. Capivasertib addition to fulvestrant improves progression-free survival in patients with advanced HR-positive breast cancer. In patients with hormone receptor or HR-positive, HER2 negative tumor resistance to aromatase inhibitors, the addition of the investigational AKT inhibitor Capivasertib to fulvestrant doubled the median progression-free survival compared with placebo plus fulvestrant in the phase 3 Capivasertib 291 clinical trial. The trial aimed to determine whether addition of the potential first-in-class AKT inhibitor Capivasertib to fulvestrant would improve outcomes in patients with HR-positive breast cancer whose tumors had developed resistance to an aromatase inhibitor. The researchers randomly assigned 355 patients to receive Capivasertib plus fulvestrant and 353 patients to receive a placebo plus fulvestrant. That's all for today. Stay tuned to Medical Dialogues for latest updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.